Yes, we're recording. Wonderful. So,
Yeah.
welcome, Sarah. This is
Hello, Jackie.
Sarah Parker Physio, who works out of South East London, and we're going to have a. I'm really looking forward to this chat because I'm going to learn loads. But talking about the pelvic floor, the importance of it for pregnancy, maybe postnatally too. We'll see how we go time-wise.
Yeah.
But yeah, we'll kind of play it by ear. And yeah, it's great to have you here, Sarah. So yeah, I just wanted to. I suppose we could start off with maybe some typical questions that I get asked. Well, just to rewind a little bit, I always talk about the pelvic floor in my antenatal courses because I find that here in the UK, if you had a couple of children or you're of a certain age, quite often people say, if you cough or sneeze, a bit of wee comes out, and we just accept that. And I say, no, we don't have got to accept that. But we just seem to do that, don't we? Here, we just accept that cough or a certain age, cough, a bit of wee comes out, but obviously it doesn't have to be that way at all.
Yeah.
And quite a few of the questions that I get asked are around the pelvic floor when I kind of cover the courses. Some women are worried about whether if they do too many, could that, the pelvic floor becomes too tight, could that be an issue for birth?
Yeah. I mean, yeah, I'm so happy that you reached out to me, Jackie. And I think we could probably talk for ages about stuff. Because it, like you say, it's just a thing that we're told to just deal with. The older you get, if you wet yourself, well, you've probably had kids, so what do you expect?
Yeah.
But it can happen to younger age women as well, and it did happen to me when I was in my teens and had this amazing PE teacher who got the trampolines out every PE session, and I would wet myself on the trampoline and think it was hilarious, but it's not normal, and that was overactive, not overactive pelvic floor, but I wasn't managing my pressure well, and so the fact that you talk so highly of pelvic floor physio and stuff in your NCT, I was like, yes. So I reached out, and here we are. But yeah, overactivity is a thing, and I think more often than not these days, because we have been cueing pelvic floor and core for decades, I would probably say, because of some research that came out. And for some reason, as humans, we seem to think that we know better than what our brain and body can do by itself. We seem to think that if we override those things, we'll get a better outcome. But in fact, we're doing ourselves a disservice by overcueing core and overcueing pelvic floor and doing too many squeezes. And yeah, I was part of that crew that used to say, 3 times 3 sets of fast squeezes, and 3 times 3 times 10 sets of fast squeezes, and 3 times 10 sets of 10-second holds every day for the rest of your life. No, that's not how the pelvic floor works, and you wouldn't do that with any other body part, any other muscle in the body. You wouldn't just work it for the rest of your life. You just go out and use it, wouldn't you? Like, you don't think about every muscle involved in walking. You just get up and walk. And that's the same for the pelvic floor and the core. Is it's working all day, every day, without you even knowing it or having to think about it. And by doing those extra bits, yes, you will strengthen it if there is a dysfunction. But for the most part, just need to let it do what it needs to do, and let it become a reflex. And so I would only give someone pelvic floor exercises if they had a dysfunction.
Right.
And that would be that they were coming to me with symptoms, either leaking or pain or and any kind of symptoms with the pelvic floor. Then I would do my internal exam and then give tailored exercises dependent on what I find. Because sometimes with leaking, particularly with stress incontinence, it's more of a pressure management thing and can be more to do with your abs than your pelvic floor.
That's really interesting. Yeah, because so if there aren't any symptoms, so no leaking or pain, then you can assume the pelvic floor's doing good. Or
Absolutely.
And reassuring, isn't it?
Absolutely. And you should be just letting it do its job.
Right.
If you're exercising, you don't need to go over and above cueing your core or drawing in pelvic floor or belly buttons to spine or any of the things that we used to think gave you core stability are actually stopping your core from working.
Right.
Because it's a natural thing. It's a reflex. Your pelvic floor switches on, your diaphragm switches on, your transverse abs switch on, and the deep muscles of the spine, they switch on before you've even moved. They're proactive muscles that switch on to stabilize your core before you do whatever it is that you're doing. You don't need to then give it more, if you know what I mean.
Right. Oh, interesting. Well, I
Yeah.
didn't know that. Yeah, I've just assumed that something had to do, because it has been drummed into us, hasn't it? You must do a pelvic floor
Yeah.
starting now for life. But if there are
Yeah.
no issues, then so then were you saying wait until you have issues, and then, well, not wait until you have issues. Let's hope none of us have them. But
Yeah.
the minute we get issues, then go and see a women's health physio like yourself. And
Absolutely. And most likely, if you're caring for your core in the right way, you shouldn't have issues. You know, if you're breathing right, if you're postnatal and you rehab properly, then you shouldn't have those issues whilst you're rehabbing or after your rehab. So yeah, I mean, a lot of the time you shouldn't need to do your pelvic floor exercises unless you have some sort of dysfunction.
Right.
And sometimes it doesn't even need pelvic floor exercises. It might need a release. If you are overactive in your pelvic floor, they can have the same symptoms.
Right.
And it might need release. And even with things like prolapse, sometimes it's the pelvic floor needs to be released because it's overactive, trying to kind of counter what the organs are doing. And so it needs release rather than squeeze. So it's a totally individual thing, you know, and it doesn't just mean every pelvic floor thing, just squeeze and get your endurance up, 10-second holds, or do your fast ones every day. It's like any other rehab. It's individual to the person. And
does that go for the same for pregnancy? So a pregnant woman doesn't need to focus on her pelvic floor unless she's having leaking.
Yeah, so when I talk about pregnancy and pelvic floor, I just think the pelvic floor, if you are having a vaginal birth, plays such a pivotal role, of how the baby moves through the vaginal canal. And so for me, I just think because we've lost that connection with our pelvises, and like God, I could get into all of this like patriarchal society of how women are treated during childbearing years is just unbelievable. And so we've lost that magical connection with our pelvises, which produces life. It makes life, and it should be bowed down. You know, it blows my mind. And I see pregnant women like, you've got a human in your uterus. And I think it's amazing. And that's been taken away from us essentially, hasn't it? And that is totally obvious to see in the way that women are treated during pregnancy, birth, and the aftercare. We just don't have it in the UK. And so we've lost that connection with our pelvis. And so for me with pregnancy, the importance of knowing your pelvic floor by doing pelvic floor exercises, that's where I would say, and I always ask my pregnant ladies, have you got a good control over your pelvic floor? Like, can you get a good squeeze? Can you relax? Have you got it mapped out in your brain so that when it comes down to it, you've got that control, and you can control it with your breath, and you can control that kind of labor with your pelvic floor, and you can feel it. You know, if you've got a good mapped out pelvic floor in your brain can feel what's going on inside your pelvis, and you're way more in control of that birthing process. And so that's where I would give pregnant ladies pelvic floor exercises, just to get it mapped out in their brain. And obviously if there's urinary dysfunction and leaking is quite a big thing, then we would explore that, but mainly to have a map in the brain.
So would you say it'd be a good idea maybe for at some point during pregnancy for someone to come and go and see a women's health physio to get that mapped out? And when that's out, what do you mean? Like that? No.
Yeah, but not even just going in and doing an internal exam, just squeezing and feeling like I'm doing it right now. I'm lifting, I can feel back passage, I can control to front passage, I can then control back to back passage, I can do a long hold, I can feel fully relaxing and opening of my pelvic floor. And that's just because it is so, the neurons are down there, so it's mapped out in my brain. And that's what that connection is. The muscle brain connection is all those neurons firing. And the more you have, the bigger that part of your brain is. And so you have a more kind of sensory input, motor output. So you've got more control over it, really. So that would be the mapping, is that kind of sensory neural input in the brain.
Okay. So
the homunculus.
Right.
Do you remember the homunculus?
I don't know.
Oh, the small person in your brain. You have a whole map of your body, sensory and motor, about where my hairband is in your brain. And like your hands are huge, sensory and motor.
Right.
And your tongue is huge for sensory. Your genitals are huge for sensory. It's like 10,000 neurons in that little tip, a clitoris and for the penis. And so they're huge in the sensory part. And the more input you, like if we wear, we wear shoes and our feet are like coffined in, our toes should be able to wiggle like our hands do.
Right.
But because we've worn shoes, it kind of smudges that area in the brain. And that's why I find it so hard to teach people to do toe spreading and toe moving, because it's not mapped out in the brain. And you can just retrain your brain to do all these things.
Yeah, so perhaps a good idea for someone to see you in pregnancy as well as maybe postnatally.
Oh, absolutely. Absolutely.
Cool, brilliant. I'm trying to think what other quite common questions have come up. So you talked about like a proper rehab postnatally. What do you mean by that? Do you mean, I suppose it depends if it's been a cesarean birth or...
Well, any birth. Yeah. Any birth is huge. And again, it just comes down to like, I don't know, just, you get pregnant and you give birth. It's just what women do. Well, it's huge. Yeah. And any other surgery, shoulder, knee, hip, anything, you would have rehab and it would all be laid out. You'd go and see physio and you'd get your sessions and you'd have your consultant follow-ups, like how's everything going? It's just not done with pregnancy. And for me, that's probably the biggest thing that a body could ever go through. 9 months of your abdomen totally stretching, and then whatever birth you have, whether it's a cesarean section or a vaginal birth, things are changed. That's major surgery, a cesarean section. If you have a tear, that's kind of can be major surgery, and just the stretch of the pelvic floor, like 1.5 times its own length, like any other muscle that does that in the body would tear, right? And for the most part, it can stretch and go back. It's amazing. And then to think that at 6 weeks, you're told by doctors, yeah, it'd be good to go back to exercise. It's like, where is this science? What makes you think that you've recovered after that much change in 6 weeks? And also, you've got a child to take care of. Your whole life has changed. Your hormones are changing. If you're breastfeeding, that's not going to change until 3 months after you stop. Your body doesn't go back kind of system-wise, kidneys, cardiac function, and all of the hormonal function until a year after birth. So to think at 6 weeks, yeah, just go and exercise. It just blows my mind. It really frustrates me, as you can tell. And so rehab needs to happen. And it needs to be bigger in this country and probably loads of other countries around the world. But for me, I see it here, and women are just left. And it needs to have a 3 to 6 month rehab process. And a lot, some of the biggest pelvic health specialists in the UK and Ireland, Grania and Emma Brockley's just actually written a book called Why Wasn't I Told? And they have come together with a running specialist physio, and they've written the return to running guidelines for postnatal rehab, which every physio trainer, anybody that touches women postnatally should read, because even though it's a return to running guideline, it's because it's running specific, but it's more return to intense exercise, and running is quite an intense exercise, so that's why they use return to running. And there's a lot of research around running and postnatal and stuff, so that's that everything is evidence based on that return to running. You can actually just Google return to running guidelines, and it outlines where you should be at with your rehab over a 3-month period. And even at that 3-month period, then you would start like a couch to 5k. So it would still be a slow return to running after you've got up to that 3-month point. And again, that's individual. It's what are your symptoms? Are you having prolapse symptoms? And that's kind of holding you back with things. And I think that education isn't out there. And so women think that at 6 weeks they should be back at their HIIT, or they should be back running. And and it's not the case.
Yeah.
And if we just knew that a little bit more, then we could take it a bit slower and understand our bodies need that and our brains need that time to catch up. And it wouldn't be such a not a mystery, but such a letdown, because women feel let down, like, why can't I run at 6 weeks, like I'm having these issues? And it's, well, because you should know your body's not ready for that, and it's not just you, it's everybody.
Yeah. And is there anything anyone can do to try and to prevent a prolapse? Obviously, that sounds quite terrifying, sort of prolapse. Well, in fact, perhaps maybe explain what a prolapse is and what parts could prolapse. And then...
Oh yeah, so a prolapse is, things have changed so much over the years, and we don't really know why a prolapse happens. We're never going to know really exactly why things happen in the body, but essentially how it displays in symptoms in women, I think that's the most useful thing, is not why or how, it's what do you experience. Is you have a feeling of heaviness in your vagina, or that things aren't in the right place, or you have increased bladder symptoms. So you get quite a few bladder symptoms of needing to go to the loo desperately, getting there, not really much comes out, or you have lots of urine left in your bladder after you've emptied your bladder, or you can see in your vaginal opening, I don't have my little prolapse chicken. You can see extra tissue, extra vaginal wall at the entrance of your vagina, and it kind of looks a bit like the inside of your vagina looks a little bit like this walnut shell, that kind of wrinkly.
Right.
And lots of women get a mirror and look and go, oh, I've just seen something in my vaginal opening that's not there anymore. And some people can see that but not feel anything.
Right.
And so it's all down to symptoms. What do you feel? What do you experience? You know, are you having dragging? Are you having heavinesses? Are you having dryness? That's another big thing with prolapse, because the exposure of the vaginal wall and drying out, and so prevention and who's more at risk, again, it's so individual, and I think it doesn't matter if you've got a really strong pelvic floor. Like, I do pelvic floor exams on people with prolapses, and their pelvic floor is working fine, because it could be a ligamentous thing inside the pelvis, you know, stretched ligaments from birth. So I go on symptoms.
Right, so there's not much we can do. Again, if wait and see, as the symptoms come, then go and see a women's health physio. And it can be fixed, can it, if you catch it early? Or
I wouldn't say it's fixed ever. It's not as in it won't be fixed ever, as in I try not to use those terms, because it's more of a management thing. You know, you might not ever fix. If you've stretched ligaments, then ligaments don't have that recoil, but you can manage symptoms. Yes, I get loads of improvement seeing ladies with prolapse. Huge. There's so much that you can do that doesn't need surgery.
right.
You know, and if you go to your doctor and gynae and they want to cut you, try physio first, please.
Yeah.
Because there's so much more that can be done without needing you to go through surgery.
Oh, that's really good.
Yeah.
And I always talk about, like, postnatally for women, if they can, go and see a women's health physio around about 6 weeks. Would you say that's about right? 6 weeks-ish?
Yeah, we do 6 weeks because of internal exams. Prior to that, we don't do them. We can see you earlier, but we wouldn't do the internal exam there. If in that 6-week period you were having really bad issues and you were desperate to see someone, then go and see a physio. But generally, we don't do internal exams at that point, just risk of infection and things. And but after 6 weeks, and also any time after 6 weeks, once you're postnatal, you're always postnatal, and it is never too late to start, even, you know, 3, 10, 20 years down the line. Go and see a physio if you're having symptoms. You shouldn't have to live with pain, shouldn't have to live with leaking, shouldn't have to live with prolapse symptoms. There's stuff that can be done, and it's never too late to start. So yeah, six weeks on.
That's so reassuring. And I I suppose it varies as to how many appointments. So it's, certainly one, obviously it's 6 weeks, and then what she may need a couple more, or we just take it as it comes, kind of thing.
Yeah, so I always explain that 3-month rehab, and then I always say it's good to come back, because then every 2 weeks we can increase your load that you're putting through your body and get you up to wherever it depends what goals are as well. Hey, so
Yeah.
always discuss what mum wants to get back to doing, and then I give options. You know, they can come and see me for that 3-month rehab, and then I get them back every 2 to 3 weeks, and we just progress up to a point. And then or if I have anybody that is like specialist postnatal PT that I know is good at managing postnatal rehab, then I have ties with a few PTs in the area that I talk to, and mums that I know mums are safe with, and we always checking in with each other. So however mum wants to continue their rehab, as long as I've made them aware of what the rehab kind of takes to get to whatever the goal is that they have in mind. However they choose to do it, then that's their choice. Obviously I love to rehab. It's my favorite thing. Postnatal rehab.
Yeah, I know. Often it comes. I think we're going to do a separate chat on this, aren't we? The separation of the muscles.
Yes.
Yeah, because that often comes up. So we'll do a separate. But what's it? I can never pronounce it. How do you pronounce it?
Well, there's loads of different ways to pronounce it. Diastasis, diastasis. DRAM, diastasis, rectus abdominis muscles. Or tummy gap usually. There's such a massive focus on it, and I was talking to someone yesterday about it actually, and I've got a diastasis and I've never had babies, and if you see lots of fitness professionals with their like 0% body fat, and you can see their gap. One lady I saw had a gap big enough I could probably fit about that much of my finger into her gap. She's never had kids,
right?
You know, just that's just
we'll do a separate talk on that, I think.
Yeah, I think so. It's a big, massive subject. Yeah, massive.
It always comes up, and women say, "Oh, when can I? Do I have to wait until that closes before I can go back to fitness?" And
yeah,
okay.
And it's always like body image, isn't it? Hey, massive body image thing again. Like women just never ending, like what we have to put up with. So yeah, we'll talk about that separately.
Yeah, brilliant. Okay. And did you have any other like frequently asked questions that you get that you think would be helpful for women pregnancy?
The one question that I wanted to ask, because I do only see ladies at 6 weeks, that initial 6 weeks and discomfort, pain, feeling of heaviness, particularly with like tears and things like that. What from your point of view, what would you advise in that initial 6 weeks for that discomfort? Just because I have people that contact me and say, "Oh, can I come and see you? I'm having this, and this, or what can I do right now to stop this discomfort or this pain?" And I'm like, "Oh, well, it's not really that 6 weeks isn't really what I've learned." I know when people come to me at 6 weeks, they're like, "Oh, I did have this, but it's kind of gone." Would you say it's like give it time, or like? I had a mum who has a toddler and then a newborn, and so obviously rest is difficult. And you have that feeling of like, oh, everything's just coming out and just painful with tear or whatever. What can mums do?
Yeah, well, I say first of all, double check that there isn't an infection present, because sometimes it's quite common to get infections. So I say if you're still feeling really uncomfortable after like a week or so, or even earlier than that, always get the midwife to double check the stitches. Sometimes infection can make things feel far more uncomfortable than they are. There's also something else that I talk about was a valley cushion. The valley cushion is kind of like there's a couple of places where you can they post it out to you. Some chemists have them as well. It's kind of like a rubber ring which you can inflate, but with a rubber ring has a hole in it. The valley cushion has like a bit in the middle, so it's not, so if you sit on it, you're not just left hanging, like a support. About so big. Pump it up like a small rubber ring, but it's got like the bit inside, and then that means she can then sit down comfortably without any pressure on her perineum. So at least then, if she's fed up with being in bed and laying on the side all the time, she wants to come downstairs and feel a bit normal, normal, whatever that is, you know what I mean, like just
Yeah.
more evolved and stuff, then she can get the valley cushion.
Great.
There's a company where you can, I think if you book it, I'll try and find it, I'll put it in the comments maybe, but I think if you phone up before midday, they'll post one out to you, get it the next day in the post, and then you
Fab.
post it back when you're done.
Yeah, because it's a bit of an unknown time, isn't it? That kind of really early kind of 6 weeks, particularly now where services in the NHS are rubbish. And, even just getting in to see someone that they don't want to look at tears, they don't want to look at C-section scars. And it blows my mind that you could ever ask somebody that isn't trained in tears and scars to just, well, how do you think it is? Like, I don't know, like, I've got discharge. Is that normal? It's like, is that the tear or C-section? It's quite worrying that they've had huge surgery and nobody even wants to look at their scars.
That's so true. I know when the women go for their 6-week check at the GP, they're like, but he didn't even, he or she didn't even look at,
want to look. One of my patients had to barricade the door and say, look at my C-section, please, because I don't know what like, if they've never had operation before, you don't know what it's supposed to look like.
I'm really hoping things get back, because I know it's great, obviously pre all this lockdown stuff, the midwives would come so within 24 hours and up for a 10-day period and back and forth. I really hope we get back to that.
Oh yeah, it's needed. It is really needed.
Pregnant and postnatal at the moment,
particularly with firsts. Quite a lonely unknown.
Yeah, exactly. And any other, just to kind of finish off, any other questions that you typically get asked, or anything that might help, any parting tips to help?
What can I do initially postnatally? Can I do pelvic floor exercises initially postnatally? Yes, absolutely. Start doing breathing, nice big 360-degree belly breathing, opposite of hypnobirthing. Inhale, expand, exhale, contract. So your pelvic floor goes through that kind of inhale, exhale, it moves with the diaphragm.
So a big belly breath is when you're expanding your belly, and then
exhale, inhale, exhale, and that just helps the pelvic floor go through that little move up and down. And then what you can do on the exhale is do a gentle lift of your pelvic floor and just get those neurons firing again, because remember, it's been stretched 1.5 times its length, so it's all going to be a bit fuzzy in the brain. So just go with the breath, because that's how your pelvic floor works. Inhale, let go, and then exhale, gentle pelvic floor lift. And you can just start doing those gentle pelvic floor lifts until you feel like you've got a bit of power, and then you can start doing long holds. Foot exercises are always really, really good to do as well, because they're right next to each other in that little person in your brain in here. And things that fire together wire together. So having good wiggly toes, good stretchy toes are going to help fire that pelvic floor and genitalia area. So breathing, lifts, and foot exercises are things that you can do as a new mum.
And when you say foot exercises, maybe mean walking barefoot around the house and trying to spread your toes and
wiggle them, turn your toes into fingers, try and separate them. And you can do it with your hands as well. And the more you kind of tell your brain that your toes are individual and not just a lump, the more they will fire in your brain.
God, I had no idea about the toes. That's so interesting.
Isn't it so interesting? And obviously they're joined to the pelvic floor via an anatomy train of fascia as well, all the way from here down to your feet, through your heart, around your lungs, which is amazing, the diaphragm, through the abdomen, pelvic floor, and down to the feet. So it's all connected.
It's all linked.
And then I think I get asked that question a lot, what I can do postnatal
right now.
We've spoken about 3 months rehab, super duper important. And also C-section scars. As soon as they're healed and you feel comfortable, looking, gentle touch, really important, again, just to get that brain firing in the area. and then, yeah, massaging that scar when you feel comfortable doing it. But I would say just come and see a physio, because we can talk you through all of that kind of stuff. And even labial tears as well. We can manage that as well if there's any pain, particularly once it's healed and you start having sex again. It can be quite painful, and there's stuff that you can do to not be in pain, and you shouldn't be experiencing pain.
So definitely see someone at 6 weeks and then get some but so when you say 3 months rehab, that means be guided by a physio or a specially trained personal trainer as to what you should do when, because that's so individual for women, rather than Googling stuff.
Oh, don't Google it. Just, get your pre-baby body back, and all of this bull. It's not true. You're never going to be who you were before, because you've got a baby, your body's changed, your hormones have changed, like everything has changed, life has changed. And for people to try and sell that dream of getting back to where you were before you grew and held and birthed a child, it's like if a football player has a, I don't know, ACL tear in the knee, they might not be back to their full capacity ever again. Why do we think that women have to get back to where we were before? We need to learn to love our new bodies. Got a baby that came from it.
What kind of superpower skill is that?
Superpower. It's magic. It's absolute magic. And we should be proud that you can do that, and that your body has gone through that amazing thing. And then it's all new now. It's learning new things. Your vulva and your vagina is not going to feel the same. Learning your body and all of these amazing things that have changed. And we just have to flip that kind of switch of what we're selling to people and mums. That's really important.
Just take your time, no rush. Took 9 months to grow the baby, however long, until you feel ready. Absolutely brilliant. Thank you, Sarah. Anything else you want to add?
No, not at all. You can find me in New Cross. I'm on Instagram, Sarah Parker Physio. Any questions, you can email me, sarahparkerphysio@gmail.com. And I work out of 2 clinics in Southeast London, Honor Oak Wellness Rooms, and the Village London, which is an amazing, incredible project that I'm so proud to be part of. And then I see people at their homes, if you're not too far away from me in New Cross, and also at my home here in New Cross Gate.
I'll pop your website in the comments.
Do. My website that desperately needs updating.
Really? Okay. Well, I'm sure it's fab. I'll put it in there anyway.
Thank you.
And, I'll stop recording now. I'll have a chat with you.
Fab. All right, Jackie. Bye. Thank you.